For the activity paper, you're going to use a template that I'm going to provide for you, and you're going to take that tool, you're going to identify a disease process, and you are going to outline in a protocol form the appropriate use, monitoring tactics, and disease progression, the treatment effectiveness, and the indication, contraindications, and hazards of capnography. So I'm just going to go right over to the template I'm going to provide you with, and hopefully you will find that beneficial. You will be able to see everything that's listed in blue. That's what you're going to change. So you're going to be able to do something on your specific disease state, and you're going to type it in here. Where is that patient located, and when would you monitor? So say it's an asthmatic in the emergency department. Okay, you're going to put your name and the date. Your abstract, you'll briefly describe the value of capnography, waveform monitoring, discuss the rationale, definitions, scope, and indications, contraindications, hazards, complications, limitations, and validation of results, your policy and procedure as it relates to your chosen disease, state, or condition. So you can use that word to manipulate it. Everything in italicized in blue, those are my words. So don't plagiarize and just copy my words, but use it as a template. You can see block style. Abstract would go right up to the top. This would come right over to here, to the side here. So I actually can do that right now. And abstract, and bring it back down. And abstract would go in the center. And so that's what it would look like. This is just my description. You put your own words, what your protocol is going to be doing with regards to your disease process. Here's your protocol. Everything that's bold, I want you to keep, but the protocol purpose. What is non-invasive waveform capnography monitoring? It's also known as end-tidal CO2 monitoring. What is it? Why is it useful for monitoring your patient's disease process on a breath-to-breath status? How does monitoring improve your patient care outcomes? I want you to identify these key terms. Again, the bold is going to stay there. So everything is double spaced. What is the scope of your protocol or policy? When and why would this policy protocol be valuable to the patient care process, for the medical staff, and also for patient care outcomes? Here is the indications. I'm giving you a little list of background of what you could say. Here's the benefits. You're going to see, I want you to use this capnogram. This is the normal, but then you have a capnogram, which is still just a pasted capogram here. But I want you to change that and choose a capnogram that's specific to your patient disease process that you've chosen. And then this one would be the post. What happened if you did something, or what would happen after you've done something with the treatment. Here is where you would list your contraindications, your hazards, limitations, and then the specific procedure. I'm telling you exactly what I want you to make sure that you include. You're not going to use my words, but you will explain the procedure. How do you do that to the patient and family? You're going to gather your equipment, your monitor and O2 sat. What is it? How is it? Discuss the patient interface process. Is this going to be a nasal cannula CO2 monitor, a micro sample, or is it going to be a side stream, a maiden stream inside of a ventilator? Discuss your alarm settings. Here are the alarms. Discuss how to monitor a patient, when to reassess, when to make changes. Discuss the importance of analyzing waveforms and the value in trends. Discuss the patient assessment, and then discuss the process of how to discontinue monitoring. And here is your references. If you have any questions, please let me know, and I'll be glad to help you. Again, use this template. I'm going to leave it available for you. And if you have any questions, just reach out and let me know. Thank you.